IVF stands for In Vitro-Fertilization and is one of the best treatment modalities in order to achieve a pregnancy. It is more complicated in the type of treatment that you do. A typical cycle takes not just 4 weeks as a normal menstrual cycle, but often takes 6 weeks to undergo. The initial steps is the female partner will undergo injections of hormones in a daily fashion in order to stimulate the ovaries to produce more than the normal amount of eggs. Typically, a female will produce 1 egg in any given menstrual cycle. The advantage of IVF is that you are attempting and hopefully getting many more eggs to grow. And the prognosis and the pregnancy rate is directly related to the number of eggs as well as the quality of eggs that we can get to grow during that cycle. When the woman undergoes monitoring, she usually has her estrogen level checked as well as follicular size. And when the day is determined that the greatest number of eggs are at the appropriate size where they can accept sperm and undergo fertilization, she will undergo a final injection of a medication called HCG, which matures the eggs to the final steps where they can accept sperm. About 36 hours later, the patient then undergoes a procedure where typically she will get general anesthesia, so she does not have any pain or discomfort during the procedure, where those eggs are then removed from her body. That is the same day that the egg and the sperm are put together to allow fertilization to occur. Approximately 1 day later, you can look and determine how many of the eggs truly accepted sperm. And then you have the number of embryos where the fertilization has occurred. You know the number of embryos that a couple has generated. Those embryos are then grown in culture, typically 2 days, maybe even another 4 days, to allow them to mature. And on that day, you can pick the ones that have the best prognosis and put those back on the inside of the female's uterus. The number of embryos that we transfer is directly correlated to the age of the patient. The goal is to try and have 1 healthy baby at a time, understanding that occasionally you will have a risk of twins undergoing such a procedure.